Namaste, Salam Alaikum, good morning, good afternoon, and good evening, friends who are watching us now and will be watching later, including YouTube. I'm Radha Paudel, author, activist, and founder of Global South Coalition for Dignified Menstruation. Global South Coalition for Dignified Menstruation is a global network led by survivors of menstrual discrimination and based in Global South. Now, I'm speaking from the Secretariat Office of Global South Coalition for Dignified Menstruation based in Kathmandu, Nepal. And we are live streaming from the Facebook page of Global South Coalition for Dignified Menstruation. This network is for changing the narratives around menstruation from 5 days bleeding to life cycle approach. More importantly, it believes that the menstrual discrimination is practicing across the globe with different names, forms, and magnitude. And it is a key determining factor of construction and shape of the power and patriarchy. More importantly, it impacts throughout the life cycle of the menstruators, both systemically and symptomatically. We, global community, can't imagine the place without the menstruators. They are everywhere, from global north to global south, from typhoon to earthquake, and from Ebola to COVID pandemic, and everywhere. In this connection, we'll be discussing about the dignified menstruation in during COVID pandemic and post-pandemic era. For this, we have an expert all the way from India. He's Karan Babbar. Let's do warm welcome to Karan Babbar, and please accept Karan Babbar. Please accept our huge congratulations on your convocation for PhD, and you are the very first PhD in your family. Very proud of you.
Thank you, Radha. Thank you so much. Thanks for the kind words. I mean, I'm quite happy.
And he's an assistant professor
Yeah.
at Jindal Global Business School, OP Jindal Global University. He has completed his PhD from Indian Institute of Management, Ahmedabad. His research areas include gender, health policy, health economics, health psychology, and development economics. His research interests include menstrual health and hygiene.
I can't hear you, Radha. Hello.
Yeah, he has a really rich background.
Thank you.
We are very excited to hear from you, Karan.
Thank you. I guess there was a lag in between. I'm not sure. Yeah, I couldn't hear you. But yeah, thanks for the introduction, and I'm glad to be here. And it's always good to talk to people who are working in menstruation. And then I remember Radha meeting you back in 2020, and I'm glad we would have this conversation today. So yeah, I'm looking forward to talking to you.
Yeah, today is the WHO Day, and the slogan is for this year is Health for All. And WHO itself is marking its 75 years of anniversary. It's already about a century, very close to a century. And since then, globally, we keep talking about the dignity by declaration of the International Human Rights Declaration. In this background, may I ask you to share your very first experience around menstruation? For example, at what age did you learn or see or knew or hear something about menstruation? How did you know about it? What did you know? What was your first reaction?
Okay, so I'll start with the story. I mean, this is a story that I talked about when I was giving my PhD thesis defense. This is sort of something that kind of motivated me to do research in the field of menstruation. So back in seventh grade, I'm quite older now. Uh, so I had like a really close friend, and then I was absent on a particular day, and the next day I was told that she was leaking blood from in between. I don't understand what that means. What what does leaking blood from between means? So I was a little scared for her, and then eventually she never came to school for the next 3 4 days, and I wasn't sure what really happened. Then she came back to school. She said it's all fine, but then I started noticing that she was quite quiet now. I mean, initially she used to be that bubbly girl who would go to multiple places and talk or being very teacher friendly. She'll go to the teachers. But then after this particular incident, she became quiet. She became really really quiet. She used to participate. She used to like really well in school. Suddenly she started becoming one of the bottomers. Again, every month she would, not come to school for 3 4 days. Until unless I didn't become quite big, I never understood what was happening. To answer your question, what was the age when I recall knowing what menstruation is? I'm sorry, I don't know. I can't recall it. But this is the first incident that I remember. Just imagine this happened in seventh grade, and I remember this incident till date when I'm almost 2 times or 3 times older than what I used to be back then. Imagine the kind of impact that I have after remembering this. Think what would be happening with that particular girl who had actually experienced this. So that's why it's very, very important to talk about menstruation. More specifically, or to summarize the overall story, when it started, before Minarchy happened, she wasn't aware of it clearly. And when Minarchy happened, before that, she used to be like really good in academics. So her psychosocial outcomes, her cognitive, non-cognitive outcomes were like really, really good. Once this incident happened, she was really not the same kid anymore. There was an effect in her attendance, in her schooling outcomes, in her cognitive, non-cognitive outcomes, in her psychosocial outcomes. So that really created an impact. So uh, this precisely sort of motivated me to work in the field of menstruation to perhaps get into it and understand more about it. So this is one main reason. Second, like that my grandmother was there, and then my mother, and then I have two sisters. So I'm gained by a lot of feminine energy, and then they have done a lot of things for me. So this is one way to give back to the society in by working in this particular field. So these are the two prime reasons which sort of motivated me to work in this field.
Okay, thank you. Very inspiring. Usually, in my experience, even the boys knew something about menstruation when they were about 5, 6, 7, 8, 9 years old. When I was teaching the students from New York, entire US, they were from grade 10 and 11, and they also knew the menstruation about the age of 5, 6, 7 years old. And that is why I always interested to know what look like
No, but then
among the
clearly,
others men.
see, we are talking almost like 20 25 years back, what happened. And back then, I wasn't aware about all these things. I'm not revealing my age here, but yeah, the point is, no one really remembers. To be honest, I don't think so. Before 10th or 11th, I was aware of what was happening. So it took me a while to reach that stage. And I believe it's the same scenario now as well. Not a lot of people know. Since you're talking about New York, their context is quite different. And the context in our LMICs is quite different. People may know, but they will know very, 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 myopic understanding of what menstruation is, which is generally one of the most common things, uh, given the fact that SRH is one of the very taboo topics in India or anywhere in the world, and anything that is taboo, people would really try to push their boundaries to understand more about it. And with lack of information, it somehow becomes a taboo, and then the taboo further creates bullying or poor psychosocial outcomes, which is in a way affecting everything altogether. So Yeah, I feel, people may not know about it, and whatever they know will be quite myopic, which is actually creating a lot of hurdles around it.
Yeah, yeah, you are right. And because of the taboo and stigma, globally, more than 5,000 ways to call for menstruation.
Hmm.
I'm not talking about India or Nepal or global south. I'm talking about the global north as well. And you have already highlighted in your several research reports about the multiple forms of menstrual discrimination, which affect the lives of the menstruators. Would you share
Radha,
the
do you
menstrual?
mind just one small thing? Okay, so this is what we all are personally working towards. So when we use the term menstruation now, since I've got this platform and we are on World Health Day, and it says health for all or health for everyone, right? So when we talk about menstruation and we use the term menstruators, so using the term menstruator just aligns them to the bodily function or to the vagina, if I can say that openly. So we at so I'm also a research advisor at pandemic periods. So we at pandemic periods and I in general are trying to move away from this terminology. And instead of calling them menstruators, we have started calling them individuals who menstruate. We recently got a publication at Lancet where we are sort of arguing for it. So if it would be great if we can move from the terminology to call it individuals who menstruate from calling it menstruators, so that at least we are not restricting things just to the bodily function and it is beyond that.
Yeah, yeah, it depends on the context and the how
I
people
don't
will think
think so. It
about
is
it.
about
Yeah,
the context because
yeah,
let's say when we
but
talk about
yeah,
let's say
but
when we talk about
in
trans
Global
men,
South Coalition, we use the word of mensurators and non-mensurators.
that's
And
what I'm
yeah,
saying.
we released the book in 2020 during the second International Dignified Menstruation Day. And that book is titled Dignified Menstruation, a Practical Handbook throughout the life cycle of the menstruators. And then we created the vocabulary, certain vocabularies for the menstrual movement. Those who believe us, we encourage them to use that vocabularies. For example, we prefer to call menstruation instead of the period. We prefer to call menstrual product instead of the sanitary product. So, but we cannot impose them, but we can offer the choices. So this is how
See,
we
that
use
is
the word of
true.
the menstruation. And then,
Similarly, when we talk about individuals who menstruate, there are trans men who also menstruate. So trans men don't have a vagina, right? They don't have a vagina. And when we call them menstruator, we are restricting them to the vagina which they don't have. That's why we need to move away from this terminology and use the term individuals who menstruate. I mean, again, like you said, it's a personal choice. You can use whatever you want to use, but in the given framework or in this seminar, I'll be using the term individuals who menstruate instead of using the term menstruators.
yeah,
So yeah, we can
mm,
we can move on that. So
yeah. For us, the menstruators is those who born with the uterus and ovaries. That means the queer trans men also
no,
included there.
no,
And
that is wrong. That's what I was trying to say because trans men don't may have a uterus but don't have a vagina. So that's the reason why we are moving away from this particular definition and we are calling the term individuals who menstruate instead of calling it menstruators. It's okay. Let's I guess move on and perhaps otherwise
yeah,
the discussion will be just about this.
anyways, Global South Coalition prefer to call mensurators and non-mensurators, and we also define what does mean by the mensurators and what does mean by the non-mensurators. Anyways, I wanted to hear more about the different kinds of menstrual practices in India and beyond, because you have been working in different platforms globally. So, would you explain a little bit what kind of menstrual discriminations have been practicing uh, in India and beyond the India?
Okay. So I feel see, this is not my personal experience, and for me to answer this question may not be right, but whatever practices I have seen in the literature, I can talk about it. So one of them would be, not sleeping on the same bed, not entering the puja room, or not doing puja at all. And then, not taking a bath during the same day, staying away from the family. These are some of the, taboos and myths which surround menstruation, which are sort of quite similar. But again, as we are moving along, we are in 2023 now, and then, things are moving on. So a lot of people have stopped doing it, but this is still prevalent, and a few families, a very few places are still, having these practices. So yeah.
Karan, I know you are not experiencing directly, but as a researcher, do you explain a little bit more specifically? For example, in Ghana, the mensurating people are not allowed to toss or to cross the river in Ghana.
Hmm.
In Argentina, not allowed to eat avocado. And in Bangladesh, not allowed to eat pineapple or
Hmm.
any citrus fruit or coconut, something like that. Can you give the examples from your
No,
country
I'm not very
context?
sure. I'm not very sure. I mean,
Okay.
see, we have a very big country. Every state has a very different context. It may even differ from state to state, and there won't be a very cohesive answer to give for this question.
Yeah, this is very true because the menstrual discrimination, Global South Coalition define the menstrual discrimination is a kind of umbrella term. It includes taboos, stigma, shyness, restriction, abuses, violence, and deprivation from resources and services that associated with the menstruation throughout the life cycle of the menstruator. So, because some people simply is called restriction, but that kind of restriction may not have in other culture, but they still don't like to use the word of the menstruation, or they are using the different kind of word. As I shared earlier, just recently the one paper released that the globally, especially in the global north, use the 5,000 words for calling menstruation. And I remember my friends called and unspoke, guest coming, red dot. So that kind of things have been using because of the travel. So we use everything as umbrella term. And then uh, since you are working as a global expert, how do you think whether the current menstrual movement address the all kind of menstrual discrimination or not, or what is the status? How do you see it as a researcher? How do you examine about the movement not only in India, the movement in global south, global north? mm, how does the movement look like?
See, again, it's a very broad question, and it doesn't have a direct answer. Let me take a very small example, and let's even talk about the people who menstruate, and we'll try to understand how you know movement is going on. So nowadays, there's a lot of discussion around menstrual leaves. So now, a lot of people who come from, I mean, the individuals who menstruate, a lot of them say or they are in favor of menstrual leaves, but some of them are not. The major reason is that if menstrual leaves are applied, there would be a high chance, based on the history that we have seen, that there would be certainly some kind of discrimination for women at work, or for women in getting the employment opportunities. Men would more likely to get the employment opportunities, is what I understand will be happening in that situation. But at the same time, there are few women who just can't even get up from bed during the menstrual days. So it's very difficult to bypass and encompass, because people can come from various fields. They can have their own prejudices, and then giving a very myopic answer to this particular question may not be very right. And everyone comes with their own directions. So broadly saying, I mean, at least we are reaching that particular direction, where at least we have started distributing free sanitary pads to the girls and women and to other genders who menstruate. That's one thing what we have started doing. I feel going forward, instead of just distributing sanitary pads, we should distribute a set of period products, including sanitary pads. Ke alawa, we can have menstrual cups, tampons, and other products which are available in the market. We make girls aware about everything that is available, tell them all the advantages and disadvantages of using that, and let them make a choice for themselves what they really want. So this is one more thing which I would love to see. Yeah, so that's about it.
Yeah, I do agree. We also do the same. We developed the one model. It is called 3P model. The first P means the person. That means the right to choice is like the contraceptive. We offer the different kinds of menstrual product which is available in the local context,
Mhm.
and also give the advantage and disadvantage. And then these products should be free from any kind of chemicals. This is how it applies for the first P. The second P is a planet, and now we all are working for the sustainability, and which is very, very serious issues. And based on the research data available, the plastic contained menstrual product is the fifth rank of the pollutions of the plastics. So it is a huge issue. That is why we always encourage to the users to think about the planet. Don't put a burden to the air, to the land, soil, or water. So, and the last P is about the pocket. Pocket means the money. And while we talk about the money, we also need to ensure the quality, the standards, availability, affordability, and if it is locally produced, we can maintain the price. But if it is, and what about the standards and quality? So that kind of things are very tricky. And if the product meet the these three criteria, and then we can call the dignified menstruation friendly product. So yeah, I do agree with you, because the menstruation is just a new movement globally. Since 2014, we start to talk openly everywhere, except medical and the business perspective. So, and we all start from the product, and most of the movement uh, right now focus on the hygiene or product and infrastructure. Last year, Global South Coalition review the movements um, uh, from Global South and Global North. We choose the two organizations from Global North and two organizations from Global South. We knew that there are the discrimination, different kind of discrimination practicing over there, but everyone talking about the menstrual discrimination, but most of the focus on the hygiene. And as you said earlier, before our the talk, the menstruation is very complex, very multifaceted. We cannot go through one sector or one project or one issue. So we need to see in a holistic approach. Let's move on. Uh, since 2020 globally, we are living with the COVID-19 pandemic. Right now, the COVID pandemic is increasing in Nepal. What about in India?
The cases are
And
increasing, coming along.
yeah, so in this connection, how did you see the 8 million mensurators during the COVID-19 pandemic? Because once we say the COVID pandemic, the lockdown, travel restriction kind of thing keep coming in our mind. And then as a researcher, how did you see the mensuration during the pandemic?
Sure. So actually, I have three papers around the same line. So in the first paper, we were trying to understand what is the impact of COVID-19 lockdown on the free sanitary pad distribution, which is a part of National Health Mission Scheme of India. So we did the study across 83 districts of India, and we found that there was a decline of almost 50% sanitary pad. There was a 50% decline in the sanitary pad distribution in the lockdown time in the red zones as compared to green zones. So red zones were the one which were strictest in terms of lockdown, and green zones were the ones with the lenient most, or perhaps red zones are the ones which have the highest number of COVID cases as compared to the green zones. So now this is what we essentially found in the first round when it comes to the government distribution of sanitary pads or maybe the products that they distribute. Next, we looked at the period product consumption side. Okay, so from the consumption lens, when we were looking at like how much are people going to spend on it. So initially, we looked at data for January 2020, and we found that 39% of the households are there in India who are spending on period products. So we were talking about period poverty much before, the COVID-19 pandemic hit. And then we tried to look at the impact of COVID-19 lockdown on period product consumption side. And we found that there was a decline of 16% at the India level in the rural areas. And when we restricted only to the red districts when we restricted only to the rural areas, this decline increased to 25%. So already the spending was quite low. Only 39% households were spending, and spending on an average was around 20 rupees on an average consumption of 8,778 rupees. So overall, a household is spending only 0.6% of their monthly expenditure on period products. And even in that, there was a decline of 16% at India level. And then when we restricted to rural level, then the decline was almost 25%. So this was quite high as a number, and it sort of shocked me. Another thing, I also did a small survey just to understand, how we are doing during the COVID-19 pandemic. I won't get into the details of the survey of what all we found, but one thing that came out quite surprisingly was the black marketing of sanitary pads and other period products. So there was this one particular girl who said that uh, shopkeeper actually told her that, "Madam जी lockdown में तो कुछ भी manufacture नहीं हो रहा है, and ये तो जरूरत की चीज है." So essentially, he was trying to say that in the lockdown, nothing is getting manufactured, and this is an essential item. So ideally, you should buy it. So in India, we use the rupee system, and a pack of pads come for almost 68 rupees, and this person was charging almost 350 rupees for the same during the lockdown. So we were able to see a lot of black marketing during this time. So black marketing was not only happening for mask or sanitizers, but black marketing was also happening for something which we call a taboo. But in terms of black marketing, they were also doing too much. So these are some of the findings that I found. A larger part that I would like to emphasize with this is that there exist certainly few supply chains which would distribute pads or which would distribute whatever is possible, right? So especially during the lockdown or during emergencies, not only specific to lockdown, but tsunami, earthquake, these things keep on happening, and then menstruation doesn't stop even for them, right? So during this time, we include everything, but we never include sanitary pads or period products, let's call it. So we don't include period products in those lists. So essentially that should be included in the list. Secondly, we also as India or as LMIs or as Global South countries in Global South or across the world really need to identify a supply chain mechanism via which they can reach out to almost every individual who menstruate, especially during the time of emergencies, because in those situations anything won't be available. But if they can, make this communication, that would be great. Third, since we are talking about COVID and we are learning a lot from COVID, so there was too much information around, hand hygiene, that we need to wash hands in specific time, and then we need to wash hands for a bare minimum time and stuff like that. So hand hygiene became quite an important factor when we were talking about COVID-19 lockdown. In the same way, during these emergency situations, there would be certainly some mechanism how we can communicate to people that menstruation also keeps on happening, and it's very important to take their care during the time of these emergencies, and they should be able to manage their menstrual needs. Lastly, we have multiple, there are multiple, programs which are started by various governments since 2010. Especially in India, there are multiple programs since 2010. So what we really need to emphasize now is that as a part of these programs, We also start teaching girls and women on how to make cloth pads. So tomorrow, if a situation comes when they might not be able to get pads in situation of some emergencies, we don't know how we going forward, how are we going to act or what is happening. So in those situations, if girls know how to make a cloth pad at home, at least they'll be able to survive, or they'll be able to manage their needs peacefully during that time. So yeah, that's about it.
Thank you for sharing. It's really very serious issue, and I still remember it was February, I think, February 2020. There was a news from China. Um, uh, the doctors and nurses were using contraceptives for avoiding menstruation because there was no menstrual product in a logistics of the COVID pandemic response. There was a PPE, the boots, the gloves, the goggles, everything were there, but there was there were no the menstrual product, and that is why it pop up in the social media, and then the government start to respond it. And I also read that kind of news in Nepal, in India, in BBC, in many places of the world, and the female frontline health workers composed like 70%, and obviously either they have the menstruation or menopause or perimenopause. They may have some kind of moderate to severe issues, health issues, and these kind of things were not addressed. As you said already, we learned a lot. Do you have any suggestions, any strategies to address this kind of situation in coming days?
Like I said, I mentioned a few points. One is we need to make a very strong supply chain distribution so that pads can go to the last mile, last available mile. Next was I talked about, importance of, like we communicated a lot about hand hygiene. Similarly, we need to talk about, menstrual health and hygiene during the time of lockdown. Third, uh, having period products as one of the essential items uh, in the lockdown or in emergencies, whatever is happening. Lastly, we should also make girls aware about how to make a cloth pad at home so that in situations of emergency, if nothing is available or if we reach at a situation where it's difficult to manage their own menstrual needs, then at least they can make something on their own and they can survive during.
Yeah, yeah, very true. I like to add one thing while we preparing the plan
Mhm.
for responding, preparation and responding for the disasters and the pandemics. The stakeholders, the concerned authorities have to include the information since beginning while developing the format for the data collection of the flood or earthquake or pandemics. That data collection format has to be changed. If they include this kind of information, it is easier to respond, I think. Otherwise, if you were there, if I were there, we can manage. Oh, there was no the menstrual product. Let's put it. Let's allocate the money. And but when the people like us were not there, this kind of needs there is a high chance of missing out in the planning process, and of course the budget. And I read in the papers and the journals that the many authorities who are working as a response for the disaster and pandemic, even they don't like to toss the menstrual product and they just throw it. So, and those who were not that much friendly, and how could we ensure the availability of the menstrual product while responding the disasters and pandemics? So, it's still very huge taboo and stigma, and we need to break that kind of silence to
Mhm.
incorporate into the planning process. And most of the you said we need to teach about the reusable cloth pad, how to make them, and in case of emergency, they can use as alternative. And but nowadays, everywhere people talk about, oh, we don't have a pad because of not having pad, we could not continue the school. That kind of comments seen in a research report in media. So how do you see from
I
that
don't
kind of
think so.
statements?
I really don't think so that at least I haven't read something of this. And I guess a larger point that I'm trying to make is if we are going to make girls aware of these things in schools or colleges, or let's say we're going to make women aware of these in these community level programs, at least they'll know that this is happening and we need to tackle this, or at least they'll have some idea, right? In that situation, even if situation like what you're saying is arising, at least they'll know what to do. In that situation, I don't think so they'll come up say, oh, we don't have pads, so we won't be using it. They can make it on their own and they'll be able to use it. Once they'll make it on their own, they'll know that it is also right and this can be a good alternative which could be used.
Yeah,
And
and
I'm emphasizing on reusable pad because it may not be possible for them to make it every day. Since it would be a reusable pad, at least they'll be able to use it again and
yeah, practically, when I had a first menstruation, I did not know about the menstrual pad. I never
again.
seen that time. And then I joined, I used the literally the piece of cloth pad. It was not like the reusable pad is like today. It is just a piece of pad I use through and through. I hang up with the panty and sometimes use the rope, this kind of thread to hang on. And
Mm,
later, when I joined the nursing college, when I started to work with the maternity ward, and then I introduced about the different kinds of disposable menstrual pad. And now, and now we have a factory in Nepal. We produce two types of pad. One is the reusable cloth pad. We keep giving the trainings in different parts of the country, and also the produce biodegradable disposable pad. And but we never impose our pads because we always believe on the 3P model, and we offer the different kinds of pads. And then but at the end of the day, and in research, in newspaper, we keep seeing that, oh, we need a pad. We don't have a menstrual pad. So that's why I'm really, really worried. If we are really worried about the environment, if we are really worried about the climate change, if we are really worried about the emergency cases like disaster pandemics, or even for the money, the reusable pad are more useful, and we need
I
to.
I don't think so. Sorry. I mean, I slightly disagree with you. See, there are multiple things that we are doing in this world. Okay. If a woman feels, or if anyone who menstruates feels comfortable in using a pad, it is all right. We should give them the choice. Ki, see, these are other options available. But I don't think so. It is right that you're burdening individuals who menstruate with the environmental wastage. I mean, it's not only because of them. There are multiple other reasons why it's happening. Okay. So maybe we can focus on other parts as well because this is something which is happening with them for every month it has to happen, right? And in this situation, let's say if it has to happen to me, at least I would prefer using something that I feel most comfortable with. And if I do not feel comfortable in using, let's say, menstrual cups or tampons, then ideally I should be given a pad. When we talk about reusable pads, I mean, okay, it's amazing and it has multiple advantages, not denying that, but at the same time we also need to recall that these are the pads, or these are the products that needs to be dried in sunlight, and it is still not okay for a lot of households to go and talk about menstruation. In those situations, drying pads in sunlight may not be a reality for many of them. So we also need to understand these facets, and then make certainly such a policy decision. So that's how I see it, because I hear a lot about this, and I understand environmental wastage is not nice. But at the same time, we also need to understand that it is not only women who needs to be burdened, because all the time we talk about gender inequality and all those things. But whenever it comes to women, or whenever it comes to the other gender, if I can say, all the problems will come out somewhere there only. Had it been men who would be menstruating, environmental wastage wouldn't have been in it, so no one would be talking about it. So there are multiple things that one needs to think about, before making
Yeah,
a policy decision like
yeah,
this. Yeah.
I'm not completing my statement indeed, Karan. Actually,
Okay.
I'm giving the different testimonies. The first and foremost is the 3P approach, right to choice. And then if there is no any alternatives, if there is the emergencies, in that case, if they know about the how to make the reusable pad, and they can use it as alternatives. And even the menstruators who like to use forever, in the to them we need to educate them about the advantage and disadvantage simultaneously. Even as a medical person, while using the reusable pad, if it is not maintain the quality, it will create the another kind of infections. I
Mm,
saw maggots by myself, by my eyes, because
right.
of not maintaining the hygiene. So we cannot impose any kind of product, but we need to educate them and give them the different kind of options. That is the thing I wanted to share, because we produce two types of the pads, but we cannot impose. We are not imposing. We come up with the idea of the 3P model, and then we explain them everything whatever available in the global market, the tampon, the panty. Even the panty, there are different types of panties. The UK produce one type of panty, Australia produce another type of panty,
Mm,
Nepal produce another type of panties. But we need to qualify it through the quality standard authority, whether it is really healthy or not, whether to what extent it contribute in terms of the biodegradability to the environment. That kind of things we need to educate while educating the product.
mm,
And I really like to hear about you, because you are men and doing a lot of work around menstruation. I wanted to go in a very micro level. Mm, what would look like your university? Does your university um, have a facility of the menstrual product, or talk or discussions? How could we make the educational institutions more friendly for the dignified menstruation or menstruation? Do you have any practice, or do you have any suggestions? Because I'm this question is usually I don't like to ask to others, but I'm very much interested. You have so many hats, and you have done so many work already. So I wanted to know. I wanted to let other friends to copy something from you and from your university.
okay, so to be honest, I don't know what specifically we are doing in terms of having a disposable machine or not, because I haven't used a female washroom, so I'm not sure of that. But largely, I can make a few points that one could make. See, there is always a chemist shop in the university or in your local premises, right? So at least that chemist shop can have period products available all the time. So that is one thing what we could go ahead with. Second, since be it usage of tampons or be it usage of disposable pads, it might be good if there could be a you know if there could be a dispenser which can be used to dispense of or dispose of these products. Third, now at least in India, we have recognized the third gender. So now, having only male and female washroom is not enough. We also need to have a gender neutral washroom. So when we have gender neutral washrooms, it might be good to have dispensers in those washrooms as well. Fourth, Let's say if I identify as a trans male or if I identify as a non-binary, and if I go and if I take, let's say, period products from a chemist shop in the university itself, they should be okay with it. They need to be sensitized enough. I mean, whenever we talk about educational institutions, we restrict ourselves only to the faculties. But we need to go beyond, because there is not only teaching staff, but there is a huge non-teaching staff, which also impacts how you come to school, or let's say how you come to college. You might have to interact with multiple people altogether. So these things are quite important that one really needs to think of when developing a policy around this. And moreover, see, a lot of people think हमने एक बार policy बना दी है, or we have made this policy once and it's all sorted. That's not how it operates. It's always good to do let's say pilot to understand how the policy is working. Talk to a few stakeholders, including girls for whom the policy is being made, or teachers for whom the policy is being made. Ask for their opinion and comments, and perhaps certainly something can come out from this. Again, like I said, it's a very broad question, very context specific, depending on whom we are talking about. So until unless we are not sure of the context, I can't make a comment just like that. But these are some of the broader points that one could follow, in addition to talking to the stakeholders for whom the policy is being made. And lastly, it might be good to update and revise the policy based on the suggestions that they receive from the original stakeholders from whom the policy is being made.
Thank you, thank you. And since you have just mm, done the PhD on the same issue, what kind of content are incorporated into the school curriculum in India?
Sorry, I
What
didn't get
kind of
you.
what kind of content? It could be the sexual and reproductive rights or the menstruation directly are
See,
incorporated in the school curriculum
in the
because
school curriculum, in
mm,
school curriculum, there's a chapter on reproduction which starts from class 6 itself, and it happens till class 10. Uh, I'm not sure if it is in 11th or 12th as well, because I never took the biology, so I'm not sure. A larger question is that, see, there are always curriculum, and okay, it will be across the countries. The curriculums are good enough. The larger part is, are we actually implementing the curriculum? Because in most of the schools, what happens, they'll either leave the chapter reproduction, or even if they'll include the chapter on reproduction, it would be very myopic. They will just cover the hard topics and not the soft topics. So they won't give any kind of practical guidance, or what menstrual cycle is, and things around that. So a very larger detailed discussion needs to be done, which is generally missing from these conversations.
no, but you are right. Having policy is one thing, and the implementation of the policy is another thing, and exactly applied for the curriculum as well. And to what extent there is a conversation among the students, between the students and the teachers or school management committee is very, very important. And when we talk about the all menstrual products, the dialogue, obviously the school management committee also have to allocate the certain budget for the conversation in the school. It is not easy, and so it has so many factors associated with this. That is why um, we need to be a little bit critical while planning. And another important thing I wanted to know from you, because as a man, while working about menstruation, what kind of challenges you face? Do you share the stories? I'm sure you have so many stories from home, from the relatives, from the
From home, I don't think so. I mean, it has always been very supportive. Be it my friends, be it my family, whomsoever I've told that I'm working on this topic. I mean, I have really received good regards. In the larger terms, let's say when I was doing data collection. So, girls, I don't think so. In LMICs, we have always had the conversation where boys and girls are sitting together and we are jointly discussing menstruation. Such conversations have been quite small. So for someone like me to go directly and talk about it, was certainly not something that these people were imagining or thinking. So that's why I just stayed away from this. So my data collection happened during the time of COVID-19 lockdown. So there was a school coordinator. I talked to this particular person. School coordinator in turn created, WhatsApp groups. And then kids were able to see the questionnaire on the WhatsApp groups and they were able to fill it. So there was no direct conversation. But making schools agree to do the data collection was a little tough task, but I guess I had certainly a few skills which helped me, getting that part. That is one. Second, there's a very famous professor. I'm just not going to name this person. Indian based out of US. Uh, they read my paper and then they heavily criticized it. I thought they might not have liked something. And eventually, all these things were happening on a WhatsApp group, so it never got leaked out. So actually, none of them read the paper, and just looking at the authorship, since I was the first author, I wrote the paper. It was like my idea. So I have been heavily criticized just for being a male and for working on it. A lot of times, people also say that um, I may not be the best person given the fact I don't experience it. But we also need to understand that there's a lot of research that goes into it. I mean, for researchers who are working on poverty, they don't go and they don't live in poverty. At least not all of them go and live in poverty to work on poverty, right? But still they're able to. A larger part why I wanted to work in this field is to enhance the discourse around it. And anything that men talk about is generally the larger discourse in the society. So that ways I feel that, that is one of the contributions that I'm trying to make it a mainstream education and so that, people can openly talk about it.
Yeah, very interesting. I spoke with the men champion from Kenya, Uganda, and they experience a lot of challenges. And in my case in Nepal, even not only Nepal, while I was talking in US, in UK, everyone said, oh, don't you feel same? Why did you talk about it? Is about the inter-religion, or you may have the money, you may have the dollars. Donors gave so much money about to speak about it. That is why you were speaking. That kind of comments I keep sharing, receiving, and then while speaking over the television or read or newspapers, the next day I received so many bad comments publicly and in my inbox as well. So I'm interested, and sharing the stories about the challenges and the solutions is always helpful to learn from others. And that is why I asked that question. And I'm also interested to know about your experience as a man. What do you think? Is it important to engage the boys, men for the conversation around menstruation, or um, it's not much important? It's because men don't have menstruation.
Don't
So,
experience it.
what would be your take?
Okay, so it's very important because I may not experience it, but people in my family do experience it. And if I understand it, at least I can help them during that time. So that's quite important. So that is one. Similarly, like I talked about, there's a lot of bullying which is done by boys to girls if they understand that the girl is menstruating. So all of these things are happening just because they're not aware of it. And this is a bodily function. You go to washroom as well, right? So it's okay to have a child, but it is not okay to understand the process of how to have a child. That's as natural as it is. So if there would be open conversation about it, both boys and girls, it would become less of a taboo. And once it's a less of a taboo, hopefully we won't be having these at least the taboo and myth related conversation that we're having now. So hopefully we'll be able to move ahead from this part.
Thank you. Thank you. We are very close to our time. And do you have any specific message to the activists who are working around gender equality or human right or SRHR.
Please reach out to me if you need any help. Please reach out to me if you need any data related help. I'll be happy to do that. And a larger part is, you all are doing some amazing work. Um, I have seen some of the, entrepreneurs and some of the policy activists who are working in the development sector. They're doing some really, really amazing work in the field of menstruation. And your work sort of inspires me to do some kind of research on it and to bring out the strong evidence. So research cannot go without policy. Similarly, policy cannot go without research. So both goes hand in hand, and it would be great if you guys keep on doing such work, and hopefully we'll be able to leverage each other's work in going forward in the future. Thank
Yeah,
you.
thank you, thank you, thank you. It is really great pleasure to have you. Thank you very much
Same
for your
here.
time.
Same.
You are so busy and so tired because you are just still have to hang around with your friends for your convocation party for your PhD. And as you said, yes, there are so many rooms we can leverage. And this is just beginning of the conversation. We can do the research, advocacy, the campaigns, and also the who knows, we may see each other in future for the conference or something like
Yeah,
that.
yeah. I'll be happy
Uh,
to see you.
yeah, and friends who are watching us, please keep following us through the social media. Next webinar will be about the digitalization of the menstruation, because there are so many technical apps already available in the market, and we will discuss about it with the expert. I don't like to disclose the name right now. We will share very soon through the event, Facebook event. And if any of you like to speak or like to collaborate for research, like to be a part of the Global South Coalition for Dignified Menstruation, please let us know. And thank you very much for watching. And once again, thank you very much, Karan, for your contribution. It meant a lot. Thank
Thanks.
you.
Thanks. Thanks, Radha. Bye. It was lovely talking to you. Bye.